Okay, guys, so we're briefly looking at what is known as a pap smear test. Pap smear test. Pap smear test. Alright, so this is like a summary trying to look at the steps involved in performing a pap smear test. Alright, so for a pap smear test, you can lie back and place the feet in a stirrup, okay, or foot on rest. Okay, don't worry, let's go into it. So a pap smear test has other names. It's also known as a pap test, it's also known as what? A Papanicolaou test. Papanicolaou test. So it's a procedure used for screening for cervical cancer in women. Right? So it dictates abnormal cells in the cervix. Have abnormal cells in the cervix, it can help to dictate it. Okay. So cervix is the lower part of the uterus that opens into the vagina. Okay. So for preparation, just like this. So patient lies on an exam table and place their feet in a stirrup position. So the speculum is insertion. So a speculum is inserted into the vagina to widen it, allowing the healthcare provider to be able to see the cervix, right? The cell collection is a speculum, right? Speculum insertion. So cell collection is using a small brush or spatula. So the provider will gently scrape cells from the surface of the cervix. Right? Can you see? This is a speculum. They put it to widen the vagina. Then this is the brush that you now be able to scrape things off. So cell diagnose analysis. So the collected cells are now placed on a glass slide, a liquid solution, and sent to the lab for analysis. Right. So what is the use of this test? Right. So it helps us to dictate abnormal tissues or cells. Right. It can help to screen for what? It's a screening test for human papilloma virus, which can actually cause cancer, cervical cancer. It's also a preventive measure. So it will help you to detect these infections quickly. So it will now help you to now start treating quickly. Right. So you see that speculum is inserted into the vagina to hold the vaginal walls open. Now a sample of cells is swapped from the cervix. Right. Now cells are sent to the lab for testing. Papanicolaou pap smear test. So frequencies of testing say that age 21 to 29, women should have a pap test every 3 years. Age 30 to 65, women should have a pap test every 3 years, right? Or a combined pap test and a human papilloma virus test every 5 years. Over 65, they may stop testing if they have regular screenings with normal results. Okay, no risks again. So results, if it is normal, there's no abnormal cell dictated. If it is abnormal, we say that the atypical cells that may actually require further testing, such as what? Colposcopy or biopsy. Understand? So that's it for pap test, pap smear test.